A very good evening and welcome everyone. I, 𝗪cie𝗿𝗶𝗀, on behalf of Voice of Healthcare, welcomes all the speakers and the viewers who have joined in for today's discussion. On the occasion of World Thrombosis Day, Voice of Healthcare has taken an initiative to bring together the experts and speakers for the resourceful discussion today. In this discussion, our speakers will talk about the signs and symptoms, latest trends, and approaches. I would like to commence this session by introducing our eminent speakers. So, for today's discussion, we have Dr. T.S. Kler. Sir is a chairman of the Department of Cardiology at Fortis Healthcare, Gurugram. Welcome, Dr. Kler. We have Dr. Ramakrishna Pillai. Sir is a director of Department of Interventional Cardiology at KIMS Health, Kerala. Welcome, Dr. Pillai. We have Dr. 𝗀𝗶𝗲𝗀𝗆. Sir is the CEO and Chief Cardiac Surgeon at National Heart Institute, New Delhi. Welcome, Dr. Yadava.
Thank you.
We have Dr. Praveen Chandra. Sir is the Chairman of Interventional and Structural Heart Cardiology at Medanta, the Medicity, Gurugram. Welcome, Dr. Chandra.
Thank you.
We have Dr. Ruchit. He is an interventional cardiologist at Masina Hospital, Mumbai. Welcome, Dr. Ruchit.
Thank you.
Along with sharing his views, Dr. Ruchit will also be moderating today's session. So without further delay, I would like Dr. Ruchit to lead this session. Over to you, Dr. Ruchit.
Thank you so much. A warm welcome to the entire audience here and a warm welcome to the eminent faculty. 13th October is celebrated as World Thrombosis Day. Incidentally, it is also World Arthritis Day. The theme for 13th October 2022 is Keep Life Flowing. World Thrombosis Day was established in 2014 by the International Society of Thrombosis and Hemostasis. 1 in 4 deaths every year occur due to thrombosis or thrombosis-related problems. In the US alone, there are 9 lakh people who are diagnosed with thrombosis and 1 lakh people dying with thrombosis. That is more than a total of AIDS, CA breast, and accidents put together. Hence, this is important. In India also, we have 64% patients being diagnosed with deep vein thrombosis, 23% patients with deep vein thrombosis and pulmonary embolism, and 13% patients with pulmonary embolism. The idea of today's session is to raise awareness about thrombosis, understand the national impact, burden of disease, need for action, public awareness, and healthcare practitioner awareness about thrombosis. In thrombosis, we would be including topics like atrial fibrillation. Atrial fibrillation means fast, irregular heartbeat, which can cause blood clotting in left side of the heart and can cause a stroke. Venous thromboembolism, that is formation of blood clots in the deep veins of the legs. These blood clots can migrate to the lungs and cause blockage in the pulmonary circulation called as pulmonary embolism. COVID-19 can also lead to blockage of the pulmonary circulation, and major surgeries can also cause deep vein thrombosis and venous thromboembolism. With this brief introduction of deep vein thrombosis and pulmonary embolism, I would like to invite all our eminent faculties for this panel discussion. The first question is to Dr. Praveen Chandra. Sir, what are the early signs and symptoms of thrombosis? Over to you, Dr. Praveen Chandra.
Thank you, Dr. Ruchit, for holding this session today and discussing the issue of thrombosis, which is definitely a problem both in the arteries of the body and also the veins of the body, as you already mentioned. So as far as the arteries of the heart are concerned, let me concentrate on that right now. When the arteries, coronary arteries, get thrombosed or get clots inside, they lead to two serious problems, which is one of the most serious events in any cardiac diseases, which is a cardiac, myocardial infarction or a heart attack in general, and also acute coronary syndrome or instability of the heart. When these patients come with symptoms of chest pain, breathlessness, and also various kind of situations of very severe breathing disorders and sometimes even collapsing. So these are the situations where sudden clot formation inside the heart is known as myocardial infarction, and the treatment of this problem should be done, and that is why it is very important to know if any such symptom is happening to somebody in the vicinity or in the house or in wherever they are working. So these patients have to be transferred to a facility where a primary angioplasty, which means immediate angioplasty or medications to dissolve the clot or dethrombose or dissolve the thrombus by these medications in the first 60 to 90 minutes. And that, of course, we all know it is known as the golden hour. And when we do this treatment of thrombosis of coronary arteries in the first 1 hour, then the lives can be saved. That has been already well documented. So that is about the symptoms and treatment of coronary thrombosis. Dr. Ruchit, you are muted.
Yeah. One more question to Dr. Praveen Chandra. Can you please highlight the problems associated with thrombosis in patients who have undergone a recent major surgery, in patients who have recovered from COVID-19, cancer patients, and patients who are having atrial fibrillation, that is fast irregular heart rate? Over to you, sir.
Yeah, okay. So, you are actually indicating towards the problem of venous thrombosis now, and that happens in those patients who are on the bed for a long time or are receiving, treatment for orthopedic problems or cancer problems and any serious diseases. And in these patients, the clots can form in the leg, which is known as deep vein thrombosis. And this deep vein thrombosis is sometimes becomes very serious situation where the clots can move from the legs and go into the lungs, and then it leads to serious breathlessness. Patients can sometimes even collapse. So these patients have to be treated beforehand, and this is known as prevention of thrombosis. So we prevent thrombosis in these patients by giving injections, which are blood thinning injections, especially in these vulnerable situations where the patient is lying on the bed for a long time or has undergone a very big surgery, which is orthopedic surgery many times. And in these patients, we can prevent thrombus formation in the legs, or we prevent DVT by giving injectable heparin injections, which is known as low molecular weight heparin, for a few days, and sometimes we put them on tablets which are known as oral anticoagulants. And these oral anticoagulants are given for a while, and then we stop it once the patient is up and about and is in his normal lifestyle. So that is about the prevention of thrombosis, and detection of this problem should be done early, and early diagnosis and treatment helps these patients. And if we don't do that, sometimes even patients can have a successful surgery but die because of a deep vein thrombosis. So that has to be prevented and treated. And the second is about the atrial fibrillation. In these patients who have atrial fibrillation, which is irregularity of the heart rhythm, in these patients, if they have it for long duration of time and also have other associated problems like hypertension, like diabetes, and advanced age, in these patients we have to give blood thinning medications, because atrial fibrillation leads to clot formation or thrombus formation in the heart, and this thrombus can move inside the brain anytime or inside the body and lead to thrombotic events. So we have to prevent, and one of the very serious events which can happen because of this thrombus migration is stroke. So for stroke prevention in atrial fibrillation, these patients have to be given these preventive tablets, which are known as oral anticoagulants. And we have now very new advanced oral anticoagulants, which are known as new oral anticoagulants. And these patients can or prevented from stroke, which is one of the very, very serious, devastating complications of atrial fibrillation. Dr. Ruchit?
Thank you, Dr. Praveen Chandra. In fact, this was an eye-opening discussion, and that is the theme of World Thrombosis Day, Eyes Open to Thrombosis. With the campaign of Eyes Open to Thrombosis, this movement aims to reach 3.7 plus billion people all over the world. More than 2,000 campaign partners in more than 100 countries are doing this campaign. With this, we plan to open up our eyes to thrombosis, because thrombosis is a neglected topic by patients as well as healthcare providers. With this, we move on to the next question to Dr. O.P. Yadav. Sir, what causes thrombosis?
Well, to understand what causes thrombosis, we must first realize that in a healthy, normal person, there is a very complex balance, or what you call homeostasis, in the blood between the formed elements of the blood, especially the cells like platelets, or plasma proteins, coagulation factors, inflammatory factors. Like that, there are so many of these factors and they are in perfect balance. And what is very pithy, or very, what shall I say, of fundamental import to thrombosis is, what we call by an eponymous name, Werco's triad. Now, this Werco's triad has essentially three postulates. Number one, we must have damage to the inner lining of the blood vessel, what we call the endothelial lining. Number two, the blood flow should be sluggish, or there should be stasis, what we call. And third, there should be a hypercoagulable state, that there should be a internal environment of developing a clot. Now, if you can tell just briefly into this, inner lining of the blood vessels, the endothelial damage, what it does is the damage can occur because of injury, because of catheters we as doctors insert in the blood vessels, or because of fracture and accidents and trauma and those kind of things. So these internal lining, they release certain pro-inflammatory and clot supporting what shall I say, molecules like the cytokines, the tissue factor, the adhesion molecules, and all of them, they activate the platelets which are responsible for clotting. Second element I told you was hypercoagulable state, means increased coagulation. They can be inherited, things like protein C, protein S, antithrombin 3 deficiency. Those are, and a lot of genetic problems, or they can be acquired. inflammatory conditions, just Dr. Praveen Chandra told, any surgery. Pregnancy is a very strong inflammatory situation. And even after 3 months after pregnancy, that increased tendency of clot formation stays in the body. Any injury, any serious infection, including the COVID infection that we are going through, these are all inflammatory conditions. Then there could be chronic conditions, like chronic inflammatory conditions are obesity, ulcerative colitis. Smoking is an inflammatory condition. Then cancers, all of them, they create an environment of increased thrombus formation or clotting. So this essentially, is the landscape of thrombus formation in the human body. Yes, Ruchit, over to you.
Thank you, sir. You brought out the concept of Virchow's triad. Incidentally, 13th October, that's today, is the birthday of Sir Rudolf Virchow, who pioneered thrombosis. His work has been displayed in Berlin Museum. So he is the one who has brought out this concept of thrombosis. And after decades, it's now that we understand how important is thrombosis, how many lives it is taking. I must reiterate that thrombosis alone is taking more lives than AIDS, cancer of breast, and road traffic accidents all put together. And unfortunately, this is an abandoned kid. Neither patients nor healthcare providers are aware about it and are focusing on it. So as general public, I want you to understand the importance of thrombosis. With this, we go to the next question to Dr. T.S. Kler. Sir, what are the different types of thrombosis? If you can shed some light on it.
Right. Thank you very much. This is a very, very important question. See, basically, we have to divide thrombosis into two categories. One is arterial thrombosis, another is venous thrombosis. So the arterial thrombosis is which happens in the blood vessels which carry blood from the heart to the various parts of the body. That means that you are getting thrombosis in red blood arteries. And the venous thrombosis is that thrombosis which occurs in the veins. Both are pretty common actually, as my colleague Dr. Praveen Chandra was trying to tell you. Usually what happens that arterial thrombosis, particularly, it occurs on already some atheromatous plaques in the vessel. These blockages may be 30, 20 or 40 or 50 or whatever blockages they are. So there is on that plaque, there is a injury, and injury exposes the, when the endothelium is disrupted, the connective tissue is exposed to the blood. And the number second is that when there is a slowing of the circulation, then you get thrombosis in the arteries. The venous thrombosis is a little bit different. Venous thrombosis occurs either post-operative when there is a immobility, like particularly orthopedic surgeries like knee replacement, hip replacement. Then obesity is a very important cause of venous thrombosis. And people who have certain kind of malignancies, highly prone to get venous thrombosis. Any intra-abdominal surgery causes risk factor to the venous thrombosis. Immobility for any kind. For example, when you are traveling in the aircraft or you are in the train, if you don't move, you keep static for a couple of hours, that exposes to venous thrombosis. Any injury to the blood vessels, can also cause venous thrombosis. Then there are certain genetic problems. One of them is one of the important is which is called as factor 5 Leiden mutation gene, which is a gene on the 2021 210A, these patients, they are more prone to get venous thrombosis, and this gene mutation has been found from 3 to 8% of European population. Smoking causes increases the chance of venous as well as arterial thrombosis. Dehydration from any cause can also lead to venous thrombosis. If there is any obstruction, for example, in the venous drainage by any means, either intra-abdominal tumors or there is a syndrome called Turner syndrome. The Turner syndrome is that syndrome where the left iliac vein is compressed by the right iliac artery, which because it crosses over to the right over the iliac vein. So that can also cause venous thrombosis. Actually, the left leg thrombosis is much more common as compared to right, just because of this abnormality. Almost 60% of the patient will get left leg thrombosis, around 40 will get right leg thrombosis.
Thank you, Dr. T.S. Clare. This was very clear explanation of the differences between arterial and venous thrombosis. We understand that both kind of thrombosis has its own minuses on the human body.
Well, Ruchit, if I have to just add one or two lines more,
Yes, please, sir.
obviously the clinical syndrome which results from thrombosis depends upon whether it is arterial or venous, number one. Number two, it depends upon the in arterial, the territory where the blood supply is going to. For example, if you get venous thrombosis into the coronary arteries, you get a heart attack. If you get thrombosis in the brain arteries, you get a stroke. If you get thrombosis, into the kidney artery, you'll get kidney infarction. And if you get thrombosis into the leg arteries, you get, gangrene or ischemia in the legs. The venous thrombosis, usually when there is venous thrombosis, there will be obstruction to the drainage of the blood in that area. So usually people will have swelling of that area. There will be, kind of pain and stiffness in that area. That is what are the signs and symptoms of venous thrombosis. Now, one of the major complication of venous thrombosis, particularly if you have a large vein involved, like a femoral vein or the iliac vein or the pelvic vein, that a chunk of this clot can travel to the right side of the heart, from the right atrium to the right ventricle, and it goes to the lungs. It can cause what is called as pulmonary venous embolism. And if it's a major clot, it can cause even sudden death. In fact, many of the sudden deaths are because of the venous, clots going to the lungs, so-called pulmonary embolism. I think that's a very, very important aspect to be understood by people.
Thank you, Dr. Clare. As it is rightly said, that thrombosis or thromboembolism is a diagnosis of suspicion. Unless we suspect it, unless we know about it, we would never be able to pick it up, and we will never be able to treat it. This is easily treatable, easily preventable condition. The eye see only what the brain knows. So it is very important for all our listeners to understand that what are the comorbidities. I mean, what are the conditions or what are the diseases in which you should think about preventing or detecting thrombosis in yourself. With this, we come to the next question to Dr. Ramakrishna Pillai. Sir, what are the different comorbidities associated with thrombosis? Over to you, sir.
Thank you, Dr. Shah. This is a very nice attempt to improve our understanding of thrombosis in general, and I am happy to be part of this campaign. to understand the comorbidities associated with thrombosis, it is best to go from the Ворков triad. The Ворков triad comprises hypercoagulability of blood, stasis of blood flow, and endothelial injury. All these three factors are important, and the comorbid conditions that associated with thrombosis affect one of these factors. Let us see how hypercoagulability of blood is important in the genesis of thrombosis. There are several hypercoagulable states. You can have an increased viscosity of blood if there is polycythemia. Polycythemia means increase, as you know, increase in the RBC count, leading to increased hematocrit and hemoglobin. This polycythemia can be primary, which when it is has been called polycythemia rubra-vera, or it can be secondary to either cyanotic congenital disease, lung disease, or renal polycythemia, as we see in hypernephroma. Polycythemia is an important cause for increasing viscosity and resulting in thrombosis. We are all familiar with children with cyanotic congenital disease getting admitted to cerebral thrombosis, cerebral vena thrombosis, and thrombotic complications. Similar things happen in lung disease as well as in other forms of polycythemia. You can also have thrombocytosis, increased platelet count that leads to thrombosis in many situations. The second aspect of Ворков triad is stasis of blood flow. The sluggishness of blood flow and stasis will lead to thrombosis. In veins, immobilization and bed rest in postoperative conditions, that is the most common factor that leads to stasis of blood flow in the veins and leading to thrombosis. In the arteries, stasis can happen when there is a total subtotal occlusion or when there is an aneurysm arising from the artery. The flow becomes sluggish and that leads to thrombosis. In the heart, now take a patient with atrial fibrillation. Atrial fibrillation, there is no effective atrial contraction and there is stasis of blood that leads to clot formation. Similarly, a ventricular aneurysm, that area does not contract and there is stasis of blood there and that leads to thrombosis. The third factor is endothelial injury. Injured endothelium predisposes to platelet accumulation and further leading on to formation of a thrombus. This can happen in the coronary artery when there is a plaque rupture or plaque erosion. It can also result from trauma or damage to the artery or vein. In short, there are many conditions which can lead to one of the three components of Ворков triad: obesity, history of venous thromboembolism, cancer, which leads to an antiphospholipid antibody in the blood, bed rest more than 5 days, major surgery, congestive heart failure, varicose veins, immobilization following fracture of hip or leg, estrogen treatment. All these can, pregnancy and puerperium, all these are hypercoagulable states. All these conditions are comorbidities which lead to thrombosis. I have tried to give you an idea of various comorbid conditions that can lead to thrombosis. Does that answer the question, Dr. Shah?
Thank you, Dr. Ramakrishna Pillai. That was an excellent presentation. I'm sure all our people, listeners who are on the show, some of them are engineers, some of them students, housewives, business people, and people from different fraternity are gaining great knowledge from this. So let's come to Indian data. One study was conducted in one of the prime hospitals in India, which showed that out of all the people in India, 17.2 out of 10,000 develop some kind of thrombosis during their lifetime. You would be shocked to know that 40% of thrombosis occur with major surgeries. 20% thrombosis occur with hip and knee surgeries. And the volume of patients who develop thrombosis and thrombosis related complications is huge. This cannot be neglected. So I'm sure our listeners would like to understand what are the risk factors of thrombosis and how can these risk factors be reduced. The next question goes to Dr. T.S. Kler. Sir, over to you. What are the risk factors of thrombosis and how can the risk factors be reduced?
Well, I think risk factors are a little bit different for arterial and venous thrombosis. The risk factor for the arterial thrombosis, they are primarily, faulty lifestyle. Smoking is a major risk factor. Then increased LDL. LDL is bad cholesterol, diabetes, and hypertension. All these cause endothelial injury, and when you have endothelial injury, then there is a starting of the atheromas in the circulation, and then then there's a nidus. The atheromas are a nidus for thrombus formation. Actually, the main reason for heart attack, myocardial infarction, is not 80% blockage or 90% blockage. It is basically the clot formation on the remaining, lumen of the artery, which causes the artery suddenly blocked, and that's how people get heart attacks or people get stroke in the brain circulation. It is the same story there. As far as the brain is concerned, you have usually either these blood clots come from the heart, and one of the important source of clots in the heart is atrial fibrillation, and some of my colleagues have already pointed out. Atrial fibrillation is the most common arrhythmia in the world today, and by the time you reach 90, almost 10% people have atrial fibrillation. If you take total strokes in the world, almost 30% are because of the atrial fibrillation. If somebody gets stroke and we don't have the reason, apparent reason, you just need to follow these patients for a long time with the internal loop recorder. And if you put everybody on internal loop recorder, any patient more than 45 or 50 years of age, almost you will be able to detect atrial fibrillation in some 25 to 30% of these patients. So atrial fibrillation in adults more than 50 years of age is very, very important cause. The second reason of these clots is the clots form in the carotid arteries. People get carotid blocks, or they get blocks in the vertebral artery, and from those atheromatous lesions, a clot forms which goes into the brain and causes a stroke. It's rare that you will have in situ, clot formation in the intracerebral vessels. Most of these clots, they come either from the heart or from the carotid arteries. Now, when we talk about the venous thrombosis, the cause is basically either some injury to the vein, that trauma, for example, then prolonged sitting, pregnancy, intra-abdominal malignancy. Malignancy causes also hypercoagulable state. And now in corona, we have seen that corona was one of the very important etiology for increased coagulability of blood and people getting deep vein thrombosis and pulmonary embolism. And I also want to tell you that almost, if you see the world data, 1 in 1,000 adults get some kind of thrombosis problem. And if you, this is, for example, when you go to the venous thrombosis, it is not a benign disease. It is a very, very dangerous disease. If you get deep in thrombosis, the mortality within 1 month is almost 6%. If somebody gets pulmonary embolism, the mortality in 1 month is 10%. So it's not a benign disease, it's a very serious disease. And pulmonary embolism is one disease which is highly, highly underdiagnosed, because when the patient dies in the critical care situation, suddenly he has a cardiac arrest, then we say patient died because of cardiac arrest. So many of those deaths are pulmonary embolism. Actually, there are studies where there was a autopsy data. If you see the autopsy data, then the pulmonary embolism mortality is 30% in those patients.
Thank you, Dr. Kler. I hope all our folks, all our listeners are enjoying this thoroughly informative session with a focus to open our eyes to thrombosis on World Thrombosis Day. We have eminent cardiologists and cardiac surgeons all across the country trying to educate you about thrombosis and keep life flowing. With this, we move on to the next question to Dr. Ramakrishna Pillai. What are the various available methods in India to diagnose thrombosis? And what is the importance of early detection and treatment of thrombosis?
Thank you, Dr. Shah. The most important aspect of diagnosing thrombosis is clinical examination. Clinical findings are the basic clues, provide the basic clues for diagnosing thrombosis. Then comes laboratory tests, and then comes imaging. We can consider our discussion along these lines. Clinical examination would be from history as well as our physical findings. In venous thrombosis, you get edema, usually edema of the legs as a manifestation, and that leads us to leads on to further investigations to prove or disprove the diagnosis of thrombosis. In arterial occlusion, what you get is a pulseless limb, for example, and cold extremities, cold limb. But clinical examination alone is not able to diagnose more than 30% of cases. We need blood tests. If you have a polycythemia, thrombocytosis, these give only suggestive information. They don't diagnose thrombosis. One test that you can rely on for providing a diagnosis of thrombosis is D-dimer. D-dimer is a marker of endogenous fibrinolysis. See, in the body, thrombus formation, fibrinolysis always keep happening, and they go together. And a marker of endogenous fibrinolysis is D-dimer, a very useful negative predictive value. More than the positive predictive value, D-dimer is extremely useful in giving a negative predictive value. There are three approaches for measuring D-dimer: ELISA, lattice agglutination, and blood agglutination. There are difficulties with D-dimer. As we go along, you'll find that. Falsely positive D-dimers can happen in recent surgery or trauma, recent myocardial infarction, acute infections, disseminated intravascular coagulation, pregnancy or recent delivery, collagen vascular disease, and malignancy. So you find a number of conditions where positive D-dimer can happen. So you can have falsely positive test, and you cannot diagnose thrombosis there. But it is negative predictive value is very important. Now coming to imaging studies, we can have non-invasive imaging or invasive imaging. Non-invasive or ultrasound or ultrasound study, MRI and plethysmography. We can add actually our CT angiography to this. Invasive studies are venography and radio-labeled pipe. Venography was the gold standard in the past. It can be useful if the ultrasound is not diagnostic. In ultrasound, what we do is color flow duplex scanning, which is inexpensive, non-invasive, and it is very widely available. And it can distinguish deep vein thrombosis from other causes like leg swelling. MRI will detect pelvic, leg, and pulmonary thrombi, and is 97% sensitive and 95% specific for deep vein thrombosis. It can also distinguish a mature thrombus from an immature clot. Nuclear medicine studies can help because the radioactive isotope incorporates into a growing thrombus and it can distinguish new from old thrombus. So these are the major ways of diagnosing thrombosis: clinical, laboratory tests, and imaging studies. Thank you.
Dr. Pillai,
Thank you so much, Dr. Ramakrishna Pillai.
Dr. Pillai, I just want to add one thing that I think the most important thing is that we should always keep a clinical suspicion in
Yes.
all these people. When we think about it, then we can do these investigations. Many times we don't think about vein thrombosis.
Entirely agree.
Absolutely true. So, with this, I'm sure our listeners all across India would be interested in knowing how to prevent thrombosis. The next question goes to Dr. O.P. Yadav. What lifestyle changes can one do to prevent thrombosis?
Well, Ruchit, the answer to your question has been given in bits and pieces by virtually every speaker. So
Correct.
all you need to do are take those small baby steps and they add together, each step, they don't add in mathematical, but they add in geometric progression. So 2 and 2 doesn't make 4, it makes 5 and 6. So first and foremost important is active lifestyle. Keep active. There's been a major study in the USA, the nurses study, which showed that one of the most important risk factors for thrombotic events of all kinds is sedentary lifestyle. So even if you were to make minor alterations at work, using the stairs instead of the lift, going to the back market to do some grocery shopping instead of pulling up your cars and scooters to go out half a kilometer, if even these kind of baby steps are taken, doing small gardening things, doing small chores, even clearing your dining table, that will add to your thing. And I stand corrected. I know it's a Swedish study or a study from Switzerland where they showed when in the corporate world, instead of sitting, the employees were made to stand and work on the laptops. They found all lifestyle disorders are reduced. So the long and short of all that I've given is maintain an active lifestyle. Second is control your weight, which obviously when you maintain your active lifestyle, the weight will get controlled. But here the point to remember is, look at those Russian bloc women and men, heavy in the shoulders, heavy in the hip, but they don't get heart attacks. And we, the Southeast Asians, barely 45 kilos, but we have got just that 2 kilo extra in a tummy that we call in Hindi tone. That is what causes thrombotic events and disorders. So we have to guard against not only the whole weight, but also visceral obesity. Then smoking and alcohol in any form. You'll be surprised. You may say, I've taken alcohol, I put a lot of water and I take 3 drinks or 4 drinks, so I've taken 1 liter of water. No, alcohol causes dehydration. The amount of urine and the diuresis we have and urine we pass ultimately it makes the blood thicker and the viscosity increases. And this is most important in long haul flights, where when we take alcohol and we are sitting in one position on a transcontinental flight or transatlantic flight, 12 hours and 18 hours, then clots can form in the leg. So keep moving within the aisle of the aircraft. Keep drinking water. Limit, or if possible, don't take alcohol at all. And lastly, stress busting is very important, because whenever stress hormones increase in the blood, the arteries constrict and it produces a milieu of thrombotic disorders. So just the small and healthy eating, all these things are of vital importance. Thank you.
Dr. Yadav, if I have to ask you a question, is there a role of use of antioxidants to prevent thrombosis?
Well, sir, antioxidants, I'm not sure. All antioxidants have failed. We have seen a number of them. If you have some data, then it's different. But yeah, sure. If you have already got a strong family history of thrombotic events, if there are other risk factors, you are diabetic, hypertensive, then an antiplatelet drug, be it aspirin, can be considered for prophylaxis of deep vein thrombosis. And using the TED stockings or thromboembolism dressing stockings, or using a crepe bandage, that can be considered as a prophylactic measure. But as far as I'm concerned, my answer to antioxidants for thrombosis is no.
No, as far as the role of aspirin is concerned, the aspirin works in the arterial tree.
Yeah.
It doesn't work in the venous tree, so it cannot prevent deep vein thrombosis. It can be very useful in arterial tree to prevent myocardial infarction or stroke. But for venous thrombosis, if you know somebody is at a higher risk, I think then only the proper anticoagulation, either warfarin or the newer drugs, can be useful. So that is one thing I think we must realize, that the aspirin doesn't work in venous system.
Thank you so much, Dr. Kler and Dr. Yadav. So friends, India, a country of 1.4 billion, having all the possible facilities, but yet we are dying 10 to 15 years earlier than our Western and Japanese counterparts. Preventing thrombosis, early detection, and early treatment of thrombosis can go a long way in improving our longevity and lifespan. Recently, the COVID-19 pandemic has created a havoc. Fortunately, we have handled the pandemic pretty well. Post-pandemic, a lot of people have developed thrombosis in the deep veins of the legs and also in the pulmonary circulation, that's in the lungs. A lot of people in the pandemic have died due to complications associated with thrombosis. Once the vaccine was discovered, there was a lot of apprehension about vaccine causing sudden cardiac arrests, sudden cardiac death. Let's understand from Dr. Praveen Chandra how true or how false is this. Over to you, Dr. Praveen Chandra. The next question. COVID-19 pandemic and the use of oral anticoagulation for prevention of thrombosis is my first question to you. And the next question which I would like you to address is COVID-19 vaccination and the apprehension about it leading to thrombosis. What are the recommendations and what are the helpful tips that you would give to our all listeners all across the country?
Okay,
Over to you, Dr.
Ruchit,
Praveen
about
Chandra.
COVID-19, the good news is that it appears that it is almost out. especially in its most severe form, which it was happening at that time, is not there. So we don't have to worry that much now. And at that time, when COVID-19 was in the most ferocious form, and then of course thrombotic events were very many which were happening. And in those patients who had very high CRP levels, where the inflammation level was very high, we did put them on oral anticoagulants for about 3 months or 6 months. And once the CRP became normal, once the inflammatory markers became normal, then the dose of thrombotic antithrombotic agents were reduced. So those medications in these patients who had thrombotic events and also had risk of thrombosis, all that was controlled with the help of injectable heparin in the hospital, followed by the oral tablets, which were the newer anticoagulants, where we don't need to monitor them, just give those tablets, and then it works quite well. And the commonest of them was giving apixaban, rivaroxaban. These tablets were being given, and now many of these patients who actually receive these tablets do not need to do that, and they just need to stop it. Number two is about the risk of thrombosis because of vaccination. I don't think people should be worried about it, and there is no need to take any tablets. There is no need to take any injections for prevention of thrombosis in any person who is undergoing a vaccination for COVID-19. So that is the current situation right now. So nothing much to worry about as far as the COVID thing is concerned.
But I will add, Praveen, one thing this is a common logical advice rather than any scientific data, that when people go for vaccination, they should be well hydrated. They should avoid volume depletion, number one. Number two, they should not smoke for, I would say, 2-3 weeks, and they should not even take alcohol for 2-3 weeks. And then, I would suggest that if somebody has a totally uncontrolled diabetes, they should first control the diabetes, then they should take vaccine. So this is a kind of common sense that I don't think there is a data available to these things, but primarily good hydration, no smoking, no alcohol for a couple of weeks before and after the vaccination, and good control of diabetes may be helpful to prevent any kind of thrombosis. But I'll totally agree with you that overall the incidence of thrombosis after vaccination is so low that one should not be worried about it at all. See, there is nothing called 100% safety in anything in life, but overall, I would say the vaccine is very, very safe, and we should all use it without any fear.
Ruchit, can I chip in?
Yes, sir, please.
I want to endorse what Praveen said and Dr. Kler said, that vaccine is safe. But we want to reassure the Indian that, look, all these events occurred with the vaccine, which is called the messenger RNA vaccines. Those messenger RNA vaccines we never received in India. They were the Moderna vaccine and the Pfizer antibiotics vaccines. What we have is a vector-based vaccine. And these vaccine-induced events never occurred with these vector-based vaccines. So that's another proof that, look, not be scared of the vaccine. Having said that, well, Praveen very, what shall I say, clearly said that the thing is over. You must have also read just 3 days back, CDC gave the ruling that masks may not be worn in the hospitals. But immediately there was a retort from a group of epidemiologists, leading epidemiologists in USA, that 2 or 3 variants which have a potential to be as dangerous as the second variety, Delta variety. And that's why they said that no, the pandemic is not over. There is a potential for it to come back, and we have to be cautious that we do not become nonchalant about these. We should continue to take all the precautions. So please, and if after a vaccine you still get any chest discomfort or breathing difficulty, please do see your doctor.
Points very well taken by all our eminent speakers and all our faculty across the country. Since we are having all prominent interventional cardiologists and cardiac surgeons here who are not wearing masks, we can definitely assume that from COVID point of view, we are in a safer zone. But as rightly pointed out, vaccines are like seat belts. They don't prevent an accident, but yes, if an accident were to occur, they will definitely protect you. So if you take vaccine, it's not going to prevent COVID, but if you develop the disease, the intensity of the disease may be mild, or maybe you might not have symptoms, or maybe you might not develop complication, and definitely extremely low chances that you will die. So the message is absolutely clear. Pandemic is not yet over. Keep wearing masks in public places and do take vaccines. In a nutshell, about World Thrombosis Day, which is 13th October 2022, the theme is keep life flowing. We must understand that thrombosis happens either in the arterial tree or in the venous system. Either which ways, if you as lay people and if healthcare practitioners have a high level of suspicion, it can be prevented, it can be early, it can be detected early and treated on time. All this is extremely important because it has a high mortality rate, which is easily preventable, especially in patients who are having diabetes, heart problems, kidney problems, cancer, old age. Old age predisposes to a fast, irregular rhythm called atrial fibrillation, which can cause paralysis because of thrombosis. All these things are easily preventable by avoiding intoxicating substances like smoking, tobacco, alcohol, and maintaining a mobile lifestyle, drinking plenty of water, and in case you are one of the high risk people who are prone to develop thrombosis, medicines are easily available. Prevention is better than cure. These medicines, they come at fraction of a cost of the treatment for thrombosis. It's time to open our eyes to thrombosis. With this, we would be happy to open the floor to any questions from the general public.
Can I ask one question to the panelists, if you allow me?
Yes, please.
That
Yes.
what is the role being played by so-called artificial food being promoted by the industry to make muscles, and the younger generation taking those things? What do you think is the role of that in thrombosis? Anybody who has the knowledge?
Well, if
So
I
Dr.
Personally,
can,
Clear, yeah.
I don't advise people to take all these commercially available bodybuilding substances, and I've seen some of the young people getting myocardial infarction. So I really don't know whether there is a scientific data to support that or not. But in general, I think some of those may be harmful. That's my view.
So, Dr. Claire, I think this has been an observation with many of us, but unfortunately, I do not have any, scientific evidence to support this. That yes, these, supplements actually increase thrombosis. However, your observation may be right to a certain extent, but we don't know.
I totally agree with the panelists that we do not have any data as such whether these young generation who are taking anabolic steroids, protein supplements, and other supplements for bodybuilding, whether it increases thrombosis or no, we do not know. But one thing is for sure, even young people, healthy people who have been exercising daily, who are bodybuilders, are exercising on treadmills, they are experiencing sudden cardiac arrest and death. The recommendations for exercises are 30 minutes a day for 5 times a week. Exercising more than that may not be beneficial and may be harmful, is the dictum. So, the message which must go to the audience, and I'm sure all our eminent panelists do agree, that if you want to build body, do not take any supplements, do not take any steroids, build body the natural way, and do not over exercise, do not overstress yourself, because overstressing might land you up in trouble someday. Do we agree to this, sir?
Yeah, of course, we do agree. See, I would rather very seriously recommend that people who want to do high intensity exercise, they should have a cardiac checkup before that. I tell you why. Because first of all, we have increasing incidence of coronary artery disease in young people in India, primarily because of sedentary lifestyle and massive increase in the incidence of diabetes. Number two, people below 35, they may have other cardiac problems which can predispose them to sudden cardiac arrest. Like, for example, one of that disease is hypertrophic cardiomyopathy, where the heart muscle is thick. And unless you have done echo, you don't know. And, many of these deaths on the field of football in the Western civilization, autopsies have showed hypertrophic cardiomyopathy. There is another disease called rhythmogenic right ventricular dysplasia. We call it ARVD. High intensity exercise in those patients can cause ventricular tachycardia and ventricular fibrillation. Similarly, Brugada syndrome and QT prolongation syndromes. So I would suggest that anybody who wants to do high intensity exercise, want to become international player, want to do marathons, it is a good idea that they should have ECG and echocardiography to be very, very sure that they are not doing any harm. But in general, I totally agree with our friend that it is the moderate exercise which is helpful for health. Severe exercise is not recommended at all for any kind of prevention of heart disease or any other disease.
Dr. Kler, I don't have you going back to where you started the discussion about bodybuilding. I'm definitely aware of whey protein is known to cause arrhythmias. You are a international repute electrophysiologist, so I should not be telling it to you, but to the audience, that excessive consumption of whey protein has been associated with irregular rhythms of the heart, life-threatening. Number two,
absolutely true.
Yeah, there is a Finnish study from Finland which has shown that anabolic steroids and high protein, it causes 33% relative risk increase in heart attacks and cardiovascular disorders. So there is data. Now the most data which comes is for highly processed sugars. And the biggest tragedy of humanity has been the introduction of fructose in 1975. Today, fructose has found entry into virtually any and every foodstuff we eat. Almost 4/5 of the food we are eating is containing added sugar. And it is this ultra-processed added sugar which in the body is converted into fatty deposition in the liver, causing fatty liver, which is now the latest fad for heart attacks, is that fatty liver responsible for heart attacks. So, and these are very addicting. That's another very important thing. Sugar is as addicting as cocaine, nicotine, alcohol. It is addicting. So that's why they are called hedonic substances. And they are very cheap. So because they are cheap, and those true healthy foods are very costly, all the manufacturers, they add these products in the food, keep the cost down, and make the patients more sick. So all these supplements, be it proteins, be it sugars, be it saturated fat, trans fat, HFSS, high fat, salt, and sugar, please beware of them.
I totally
On a
agree with
lighter note, sir.
These so-called artificial feeds and steroids, some of these can cause what is called as repolarization of anomalies on the ECG. And if there is a QT prolongation of some kind with these, you can have cardiac arrhythmias. See, when I just want to come back to the question of antioxidants, I want to make everybody clear here that the artificial, or you say the antioxidants available in the industry, they are no good. There is no data to support the use of tablets in the form of tablets antioxidants. But yes, true natural antioxidants, for example, green vegetables, fresh fruits, particularly colored fruits, they are useful, and they might prevent disease in general, and also may help to prevent thrombosis. That's my view.
On a lighter note, I would like to share the statement of one of my mathematic friends. He says that taste in the food is directly proportional to the amount of salt, sugar, and oils. With that, we come to the campaign of एक चम्मच कम. अगर एक चम्मच salt, sugar और oils कम लेंगे तो heart problems कम होंगे. So all these artificial foods, these fast foods, junk foods, they have a high content of salt, sugars, and oils. So I would urge all our youngsters, business people, housewomen, to read the labels on the food substances. Once you start reading the labels on the food substances, you automatically start understanding what foods to buy and what to avoid. This level of consciousness is extremely important, which should percolate in our society.
Not only read the labels, read between the lines of the label.
Absolutely true.
Another thing which we have not